is technique for the back as a whole, not so much to the neck and shoulder, using sideline technique. It's very, very good, especially if the clients start having more ache. So the more ache they have, the more I would be putting them there right away into the sideline, because it's very accessible, it's very safe. They're not going to have muscle spasm when they are lying on the table. It's very accessible because I can do a lot of mobilization. And especially when it goes down, I can use this technique to work on the Quadratus Lumborum, on the deeper muscles on the back, and also attached to the hip muscle. And you will be amazed how many people, when they have backache, first it actually means that it's on the upper hip, or the upper hip is really, really stiff. So I almost always, with backache, lower backache, I check the hip muscles. Yeah? So, draping, you can do that in a simple way. Can you bring this hand upward, outside the towel? Good. So the way I would use it, I will use their hand as a frame, and all I need to do is really just flip that, and the back is ready. Yeah? So you can do that, really nice. And they are warm also. Okay, that. So start with Effleurage. It requires you to be a bit more lower, and instead of having their body this way, you need to change. You need to do a bit of a twist. But again, you can't do it with your upper back, yeah? It's even further that you need to use your legs. So if I'll take my hands off, that's what I'm going to do. Okay? You can do it from here, you can come from above, but then you need to hold the shoulder a little bit, because if not, sometimes that would happen. You see, I do it, you see that it's moved and kind of be annoying. So one hand in here. Maybe even from here. Do that in this position. Try the 3 positions, okay? This one I don't feel as comfortable. Give it a try. Right. Now you have to come closer. Yeah? And what I want you to see, come closer in here, yeah? What I want you to see is that erector spinae, yeah? Now, usually when we're working from the top, now I would like to work from the side. So I can do, taking 2 hands this way and working onto the side. Good. So you're working on the side, or coming from the front, you can work from, it's a lot easier. Finger kneading, reinforced finger kneading, even with knuckles. But you need to come kind of really close to that position. If you feel that it's not, you're too short for that, then you can't do that. You have to change into a different position. Very nice. You can work really deep. It's very easy because it's upward. You don't have to go down to. Good. You can also do some mobilization. So a lot of our clients having more increased kyphosis. Yeah. Very nice. You can come just to here and mobilize their back. So you're holding one hand here and then pushing onto the middle back. And what you do really is flatten it. Yeah? I mean, this client doesn't need it, but other clients that are very pronounced forward, you can do a lot of stretching this way.
Sure, are you actually pushing on the spine as well?
It's on the side. It's on the side of the spine. I'm on the muscles of the spine. Yeah? Good. And getting there, I want to now getting into the lower back and showing you the Quadratus Lumborum. What you do with Quadratus Lumborum, you might need to have their hand bent a little bit. And then, if you remember, the first superficial muscle is the erector spinae, and Quadratus Lumborum is deeper, but it's flatter. So this is the erector spinae, and what you're trying to do is feel the edge of Quadratus Lumborum, yeah, which is kind of here, in between the hip and the lower ribs. So you can do it slowly with your thumbs. You can go from here, okay, this is the erector spinae, and then you go to the side a little bit more higher. Yeah, okay, it's about here. If I go more front, I wouldn't feel anything because it's the abdominal viscera, yeah? Now, be careful, don't be very pokey. In tension in your lower back, that can be making a huge difference, but you have to be careful not to overwork it. How's the pressure? Can I go deeper or it's enough? Yeah. At times you would not be able to feel, but at times you would be able to feel Quadratus Lumborum. Yeah? It's if the erector spinae finish here, Quadratus Lumborum finish a bit above and in front. So this way and in front of it. Good. One last thing, and I'm going to do it over the towel, is feeling gluteus muscles. Very important, especially when you go close to the sacrum. You know, all these areas, sacrum, Quadratus Lumborum, you can use your elbow if needed and just sink in and feel where the tension is. Yeah, and move it. Okay, so just as a revision, Effleurage from here, Effleurage from here, and then if you need also, you can do some Effleurage from here. Yeah, you can do the shoulder, remember, we did before, yeah, and then doing some petrissage from above, yeah, with your thumbs, or from here, fingers, you can do kneading, you can do alternating hands, but a lot from above down, yeah, finger kneading, very, very easy technique. Quadratus Lumborum, glute. Okay, speed, sideline. Great.